Awesome. So my name is Kelsey Schmitz, and I am the School Mental Health Lead for the Northwest Mental Health Technology Transfer Center. And I work for the University of Washington. And the School Mental Health Supplement for the Northwest Mental Health Technology Transfer Center is housed at the SMART Center, which is the School Mental Health Assessment Research and Training Center. And we're excited to have you for our session today, which we'll tell you a little more about. But as we get started, our funder, SAMHSA, asks that we provide a disclaimer that the views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services for SAMHSA or the U.S. Department of Health and Human Services. So at this point, we just want to take a few moments for a land acknowledgement. The University of Washington SMART Center and the Northwest MHT acknowledge that we learn, live, and work on the ancestral lands of the Coast Salish people who walked here before us and those who still walk here. We are grateful to respectfully live and work on these lands with the Coast Salish and Native people who call this home. We also have a panelist that's joining us today from the University of Maine at Farmington, and they're located on the land of the Wabanaki, which includes the Penobscot, the Passamaquoddy, the Maliseet, and Micmac peoples. And they are grateful to respectfully live and work on those lands with the people who call that home. And we really hope that all of you will take time to learn more about the ancestral lands that you are joining us from. So for those of you who may not know much about the Mental Health Technology Transfer Center Network, it was funded by SAMHSA in 2018 and includes 10 regional centers, a National American Indian and Alaska Native Center, a National Hispanic and Latino Center, and a National Network Coordinating Office. This series today has been sponsored by our Northwest MHTTC, and we know that many of you are joining us from outside of our region and want to make sure that you know about a regional resource that you have in your area as well. So this slide tells you a little bit about how you can connect with us at the School Mental Health Supplement team. That's part of the Northwest Mental Health Technology Transfer Center. You'll notice our website. You can email us. You can sign up for our newsletter that we send out monthly. And we'd love for you to connect with us on social media. And just a shout out to my amazing colleagues, Megan Lucy and Natalie Flores and Eric Brenz, who help support this work. So just a quick review. We have held 2 sessions on managing anxiety in the Return to School series, and today's format will be just a little bit different. We are taking the questions that maybe we haven't gotten to in those 2 sessions, questions that we got through registration, and making these experts available to you for the rest of our time today so that you can ask questions that you may have. And the way this is going to work is we have put together some questions and they're going to take those and start answering a few. The other thing I want to mention, and we'll get to a little bit at the end, is that we are going to be putting together a Managing Anxiety in the Schools toolkit. And we want to get some information, some feedback from you all about what would be helpful to have in that toolkit, what format would be useful for you all. So I'll mention it again at the end, but kind of be thinking about something that would be helpful for you in your role to have to support your learning around anxiety in schools. So I took the questions that came in. Natalie organized them for us. And then I'm always looking for a good excuse to do a word cloud. So I thought it would be neat to throw the questions into a word cloud and see some of the more common things that showed up. And then I also provided you some of those categories or topics that showed up in some of those questions. So at this point, I am going to introduce our panelists for today. We are thrilled to be joined again by Dr. Kendra Reed, who is a clinical psychologist and the director of the Mood and Anxiety Program and director of anxiety programs at Seattle Children's. She's also the director of psychotherapy training through the University of Washington School of Medicine Child Psychiatry Fellowship. We're also joined by Dr. Jennifer Blossom, who's a clinical child psychologist and is an assistant professor in the Division of Psychology and Human Development at the University of Maine, Farmington. And joining us today is Dr. Cecily Stepney, and she is a clinical psychologist at Seattle Children's with roles in the departments of psychiatry and behavioral medicine and adolescent and young adult medicine. So at this time, I just want to invite Cecily and Kendra and Jen to come on video and wave and introduce yourselves. And then I think Kendra is going to walk us through a few slides just to review and reorient to just some of the material they covered. And then they're going to turn off the slides, and I think Kendra's going to facilitate some of the questions and answers. We'll let you all ask some of your questions, and that's just how we're going to spend our time today. So thanks for being with us, and I'll let the three of you take it.
Thanks so much, Kelsey. We are so excited to be here with you all. Thank you for making the time in what we imagine are very, very busy schedules to be here with us today. Anxiety is something that all three of us are very, very passionate about in terms of helping youth and their caregivers in all those various forums help them cope with anxiety and figure out what to do when it starts to impact their lives. So you can see our bios here, and we may share a little bit more about ourselves as we go. You have heard, if you have attended our previous talks, a lot from myself and Jen Blossom, but I really do just want to call out Dr. Stepney's involvement with us today and volunteering her time. She has extraordinary expertise in the treatment of anxiety disorders. She is also a provider in our gender clinic and works a lot with adolescents. And she just brings a lot to the table for us to kind of enrich our discussion here with her expertise. So Cecily, I'm not sure if there's any more you would like to say to introduce yourself here before we get started.
No, I don't have much more to say, but I'm excited to be here.
Great, thanks so much. So I just wanted to go over a couple of quick slides to review some of the things that we talked about in the, excuse me, in the initial two seminars that we've done. These are review, and some of the questions pull on some of these topics, so we'll dive a little bit deeper as we go. So rest assured, if it doesn't sound exactly clear, you can pose a question. We have questions to follow up on this information as we go, but just wanted to set the broader framework. To start, we have no disclosures to share. So the key points from our first seminar were to really emphasize the importance of approach. So as we think about the evidence-based interventions for anxiety, the key intervention is really around what's called exposure, or facing one's fears. So the key way to help youth when anxiety is problematic and affecting their lives is to help them approach the things that are anxiety provoking to them. We want to avoid doing things like excessive reassurance, distractions, or accommodations that encourage them to avoid the things that are anxiety provoking. There are ethical boundaries here and limits, as we talked about. We want to make sure that if we're doing an exposure, it is something that is objectively safe and is something that is important for the youth to learn how to cope with in their lives. What's not harmful but not proven to be helpful for youth with anxiety are strategies like relaxation strategies, journaling, other skills. These things are not tied to treatment outcome. In fact, we have there was an article that just came out that showed that when relaxation skills are a part of treatment, it actually limits or slows down progress in treatment for anxiety. We also know that this sends a conflicting message. Relaxation sends a conflicting message about the potential harm of those bodily experiences of anxiety, of like, anxiety is not harmful. It's a totally normal experience, but calm your body down, relax. And that inadvertently tends to build a fear of somatic arousal for anxiety. So instead, we want to help kids ride the wave, know that this is going to come up and it's going to come down. We don't have to do anything to make it go away. Some key points from part 2, and Jen and Cecily, feel free to jump in if you have more to share here, but really just want to rocket through the slides so that we can get to the questions. From part 2, we talked about how the COVID pandemic is affecting communities of color disproportionately. So we talked about how that is true in terms of objective safety, illness, the impact on available resources, and then subsequent impact on mental health, and knowing that a lot of these communities really struggle to get fair access to mental health resources. We also talked about how some of the primary mental health impacts from this pandemic appear so far to be low mood due to isolation and anxiety due to uncertainty. There's a great deal of uncertainty still, even though there's a lot of hope that there's an end in sight for us. And if we take all of this together to help think about how do we help our kids cope in a situation like this, we really want to think about those small steps of approaching objectively safe and normative behavior, how we can get them to take those small steps towards those things when the situation is not objectively dangerous and it's a situation that the child should learn to cope with. So say, and this came up a ton in the questions, turning on the camera for Zoom classes, participating in the available social and educational opportunities that are there, acknowledging that it's not the same as it was when we were engaged in person versus remote learning. Cecily, Jen, anything you would add to that recap? Any additional points you would like to make?
I was just going to say, this just came up in my anxiety group that I teach for parents of kids of 6 to 8-year-olds. And we talked a lot about how like we're in really uncertain and very odd times, right? And so that we can expect, right, that our kids might be struggling more with school, and to validate that they are struggling, and that there's also this expectation that they need to participate in the things that will continue and further their education and help them to socialize, right? So both of those things can be true, that like right now is really hard for people, and there are things that we can do to not make it worse, right?
I think that's a really good point, that combination of support or like validation of like, I get that this is hard, and confidence that they can do it, even though they can do hard things, to quote Glennon Doyle a little bit. Jen, anything else you would add?
No, I think you both covered it beautifully.
Okay, great. So now I'm going to stop sharing, and we are going to move to the question portion of today. So as Kelsey noted, we have a list of questions that came up across the previous 2 seminars, and I'm going to try to chunk them together, but please feel free to drop any questions that come up for you as we talk in the Q&A box, so that we can make sure we're also addressing your current questions. Okay, so one of the things, and this was a big theme that came up, was around how to help youth engage more in remote learning, knowing that kids are avoiding this. It might be because of anxiety. How do we know that that's that it's anxiety that's driving that avoidance or disengagement, and how do we help them engage more? So let's start with that one and break that one down. Cecily, Jen, anyone, you want to take a chunk of that off first?
I thought Jen was going to unmute. Yeah, I mean, I think it's tricky, right? Because like as we were just talking about before, that I think there is, serious Zoom fatigue and all these things that make remote learning really challenging. And so I think sometimes it's a little tricky to know, is it anxiety or is it not? And so one thing that I've talked about with a lot of parents recently is just making things kind of time limited or more manageable, right? That we have to set expectations that we think that students can reach. And you don't want to say like, okay, you need to sit on your computer for 6 hours, because that's unreasonable, but maybe let's sit on the computer and do this one class and then we'll get up and take a stretch break, right? Breaking things down into smaller chunks so it's more doable. I know for some parents of younger kiddos, they've also found success like, well, I will sit with them for this period of time and get them started, and I can go, tend to my own work and come back. Just trying to figure out how to do that balance, I think, is really tricky. And sometimes having a parent sit with you is like a nice mini exposure step to then have the kids be able to sit on their own too.
Yeah, I love those ideas that you just shared, Cecily, and it makes me think the kind of just test it out idea. If you're having difficulty assessing, is it anxiety related? Is it something else? Is it Zoom fatigue that we're all feeling? Try it out, right? Because that's going to help you learn. So if you try some of those steps that Cecily just described, you'll get more information about maybe what's getting in the way for them.
Yeah, that's a good point. It almost doesn't matter at first in terms of what your first step is, whether anxiety or another emotion is driving the disengagement from Zoom, because either way, we're going to be encouraging approach, even if it's task refusal because, oh, it's so boring, or I hate this class, or I'd rather, fill in the blank, do anything else. It doesn't matter. And as we start to approach the situation, set goals, reinforce that approach with some positive reinforcement, we learn more about what the true drivers are, what your kids are thinking. And I think one of the things that Cecily said right at the beginning is key here, just to validate that this is hard, even if you're not sure exactly why it's hard. For the child in question, like, I get that this is tough right now, and I know you can do it. Sorry if you can hear I'm going to try to close my email in the background. So I think that is really important as well.
And I think too, you just mentioned, Kendra, like rewards and reinforcement is so key. And for different people, you have to incorporate that in smaller chunks of time, right? For some people, they need it like every 10 minutes, and for other people, it can be a whole day. And some of my parents recently have found a lot of success in recruiting teachers to be the ones who are doing some of the monitoring, if you have a teacher who's able to do that. So then that it takes away a little bit from the parents having to constantly be monitoring their kids, which isn't feasible for everybody. So if it is within the wheelhouse or abilities of teachers to help with that, I think it can be really helpful.
Yeah, absolutely. And I think it can feel hard for the educators in this setting to feel like they have to monitor this other thing. So really is a compromise between the family and the educator of what is a system that's going to be feasible to implement. How frequently what behavior are we monitoring? How frequently are we checking in? How is there going to be communication about this regularly? There's never been one plan that has looked the same from like patient family to patient family that I've used with schools. It's just the general idea of setting a goal, having everybody be on the same page, and think about how are we going to get the information to the parents if they're not able to sit there the whole time, so that they can positively reinforce the child. And also the educator, sending a private chat to say like, I see you turned your camera on. Nice job. I know this is hard. You're doing it. Those moments of praise should not be underestimated. They're really meaningful. Okay. So there was one question that came up that said, is it helpful to pull all the way back for a student who is very anxious, to pull them out of school entirely to homeschool for a year of one-on-one, then a year of a smaller number, social situations, etc.? And I just want to jump in here and say that our environment right now is restricted because of the pandemic. So there are things that we're dealing with now because we have to in order to stay physically safe from a virus. And what we know is that remote, or homeschool or remote learning really hits anxious kids in a sore spot. It really limits their ability to learn that this is not as bad as they think it is. So I would not recommend unenrolling youth for say a whole year of homeschooling because they're very anxious. We actually know that anxiety can change very quickly, and unenrolling youth would, from my opinion, would really underestimate their resilience and their ability to learn and grow in the face of anxiety. But Cecily, Jen, what are your thoughts about that question?
Oh, now we both unmuted at the same time. Go, Jen. You go first.
I was going to say, I think it's certainly a complicated question, as Kendra acknowledged, with everything that we have going on here. But I think in the same way as we were just talking about finding the small steps forward, I think we always want to make sure we're not overcorrecting, right? So if we find what's currently working, or what's currently not working, rather, we want to kind of better understand that situation and figure out how we move towards the goal, not take big steps farther away from the goal, because then it just gets harder and harder to do that, right? So if we have a student who's joining even 10 minutes a day, that's 10 more minutes than if they weren't joining at all. So we want to help, how do we increase the number of minutes that they're joining, not take away those expectations? And I think a big piece of that goes to the point that Kendra was just making, is we're sending messages around their own, as they learn about their own efficacy, their own resiliency, what they are able to manage. And if they're getting messages from their environment, from important adults in their environment that, oh, maybe you can't handle it, or maybe this is too much, then that's information they're going to internalize and understand, and that's going to set their own expectations. So if we have that balance that Cecily was describing just a few minutes ago of validating it's really hard and that 10 minutes is awesome because that's where they are right now, how can we get you to 15? That's really the goal that we would want to be thinking about.
Yeah, I would agree that it's much harder to come back from being totally homeschooled. And I think it'll be really interesting once we transition out of the pandemic too, to see how that impacts kids' ability to jump back into brick and mortar schools, right? I think it's going to be, some kids are going to be leaping for it and other kids are going to be like, yes, I didn't have to interact with people. So I think we'll face that challenge when it comes on though.
Thank you both. I'm just trying to keep it. We have some really wonderful suggestions coming in from Saeed in our chat. So I was just trying to read those. So great. One of the questions that came in our live chat that I just want to bring in at this point is, there are parents who have multiple children. They're dealing with virtual schooling. Some of those parents are also working on top of this. How do you help them with their anxiety and stress? The parents. What are your thoughts? I've got thoughts. What are your thoughts? Let's start there.
I mean, I'm a big validation fan, so I like to start with that, yeah, this is really hard right now. And in a lot of ways, it's an impossible task, right? And so helping people think through, is there other support sources that you can tap on? Like if it's a multiple parent household, could you tap out when you're realizing you're feeling overly stressed, although that's not possible for everybody, right? And so, yeah, I think, validating that is really a challenge. And figuring out if there are different kids who could support other kids, even though that's not their job, right? But this is kind of like unprecedented times. And at least in my parent anxiety group, I'm always encouraging them to think about how can they apply the skills themselves. And if if the stress that the parents are dealing with is just like COVID related stress and not their own anxiety, that might be an opportunity to practice some distress tolerance skills. It's like, I'm going to go step aside. I'm getting frustrated. I'm going to take some breath. I'm going to do some mindfulness, and then I'm going to come back. And that's different than if we're like encouraging people to do exposures, right? Because this is like a real stressor.
Yeah, I think just as Cecily was saying, using the same skills that we're asking parents to help their kids use with themselves, right? So making sure they have realistic expectations. If their 5 children all joined Zoom for 10 minutes that day, that's awesome, right? So it's not, we have 5 kids that were connected and on task the entire day. That's way too high of an expectation potentially. So I think it's just being realistic and helping them find the milestones too. And I think when we're able to do that, you know, I teach early counselors, early career counselors. And one of the things I always talk about is that I find it's most helpful to be able to tell and help others work on these skills when I actually have my own experience practicing them. We want parents to be doing that with their kids. We want educators to be doing that with the kids too, right? Because then you can speak from your personal experience about why this has been so helpful, or that validation, you know, becomes across so much more effectively because you're describing from your own experiences. So just as we're trying to talk about getting kids to kind of work up to that 15 minutes, joining for a full class, we want to find parents understand where they are and then figure out what's that step forward and what's realistic for them to be able to do at that point.
And what a great model caregivers serve in that moment, to be able to narrate, ooh, like mom or dad or whoever just had this, I just had this really harsh situation. I was feeling really stressed or nervous about whatever situation that was happening. And here's how I adaptively coped with that. Here's just like validating that was hard. And here's how I found a way to take a step forward, or to, you know, just cope in a way that was adaptive, that led to positive change and movement forward. I think that the analogy of that, and we've talked about this probably a couple of times, but the analogy of the airplane emergency of like, put your oxygen mask on first, is a key one in this situation, because you know, we want to make sure that all youth are accessing their, you know, this appropriate education, and if but not at the expense of other, like the family's global health, right? We can come back from a missed day where we didn't connect. It's so much harder to come back from, you know, some of the other long-term consequences that might happen if we are pursuing single goals at the expense of all our overall well-being. So really wanting parents to think about how can we kind of break this impossible task down into pieces to see, like, what can we realistically commit to, and for the things that we are going to miss, because we're all missing something these days, who could we communicate to about that, to say, just a heads up that this is not going to be something that I can do. There's an interview, and this is some internet meme that I saw, but there's an interview with the writer Nora Roberts, where she talked about, and this was years ago and not about a pandemic, but talked about being a writer and having kids, and the analogy of there being, I'm probably going to say this imperfectly, but there being multiple balls that you're juggling, but some of them are plastic and some of them are glass, and knowing that, like, some things you can drop or put down for now, and it won't be as catastrophic as we might worry it is. So starting to think through, what are the pieces that we can, like, let go of or set aside for now to come back to later.
I think that's a great point. I'm going to keep bringing up my anxiety group because it's fresh in my mind, because I had it yesterday, and we spent a lot of time talking about school yesterday. And one of the parents brought up that she's studying to be an educator, and that, you know, if this year all we do is help our kids get through learning math and like literacy skills, like reading and writing, then that's great. You know, like the music, the art, which, you know, all that stuff is really important to me, being daughter of a theater professor. And yet, like, some of those things, it's okay if we can't fit 6 classes or get everything done. It's just not always a reasonable expectation.
Thanks, Cecily. One of a big chunk of questions that we received came around like how, if we're changing the perspective of 504 plans and IEPs, which have historically, not in every case, but in many cases, they've historically been written to promote avoidance or distraction from anxiety-provoking situations. What are the things that we should write instead in place of those less helpful accommodations? So I'm switching gears a little bit, but and one of the things we acknowledged in the previous seminar is that we really want the accommodations and IEP goals to be specific to the student's situation. So whatever the feared situation is, we want to tailor the wording of the 504 accommodation or IEP goal to that specific circumstance. But I just wondered if we could brainstorm some specific examples to here to give our educators a flavor of what this would really look or read like. Thoughts?
So one thing that came to mind that I don't think we've talked about specifically before is around something like test anxiety. And I think one of the things that really gets in the way that I've seen frequently is that the same accommodations that would be applied for a child who might have ADHD or some attentional concerns are also applied to a child where test anxiety is driving performance issues. And that's, I think, a perfect example where we would want those to look very different, because likely what's getting in the way for a student with test anxiety is worrying about what if I get something wrong? What if I didn't study hard enough? And they're kind of getting lost in that headspace. And what we want them to do is just answer the first question, right? So we want to make sure that we're not providing extra time for something that isn't directly related to a processing or attentional issue that requires that accommodation in a very different way. This is certainly complicated because we know also that ADHD and anxiety are very highly comorbid. We have a lot of students that have both of these concerns. And I think that that's where some of these issues with 504 and IEP can get really complicated to kind of figure out how you're supporting the student in the best way possible, accounting for both of those things. And I'd love to, if Kendra or Cecily, if you have specific ideas or examples from your clinical practice about what this has looked like or how you've supported families when that's the case.
I mean, I think sometimes it depends what the driver is. I know for some people who have like perfectionistic tendencies, that a helpful accommodation in the short term might be having the teachers set give them an estimate of how much time they expect the assignment to take. Like, I expect that it's going to take you 30 minutes and that's all they're allowed to spend on it, and then turning it in anyway and probably realizing they're going to do better than they expected. I've also had for some students like being able to complete like every other problem in a time frame, which is also anxiety provoking if you're a perfectionist, because you're like, I want to do all of the problems, and that's not always needed. Kendra, do you have other thoughts?
I think those are really great ones, and it highlights one of the key things that we often see in 504 plans and IEPs, which is this allowance of extra time, which is often a trap for anxiety, because it's not that our youth with anxiety are using that time adaptively or effectively. They're using that time to worry more, to overcorrect, to overdo their work. And so it ends up being counterproductive and thus contraindicated really for special education plans for youth with anxiety. Though it does seem to be the thing we keep in our back pocket to pull out when we're not sure what a child needs. So I would just point that out, that most of the time I'm asking schools to get rid of that one, to do exactly what Cecily's saying, which is, hey, let's keep to the time frame. Let's turn in what you have done and do that exposure of like, what if it's not perfect? Is it as bad as I think it's going to be? What is the consequence of getting a lesser score on this assignment compared to my catastrophic thought about what's going to happen? So I think those are really good ones. Really, it's just, it's hard to think of specific. I'm trying to conjure up some specific cases that I've seen and what I've encouraged instead. You know, a lot of times the accommodations I'm talking about have to do with selective mutism or school avoidance. And so we're really talking about like, what is our current verbal goal? Is it speaking one time to the teacher one-on-one? Is it, you know, is it different? Is it responding to questions, asking a question? What is the goal in terms of level of verbalization? Who's around? How many people are also listening? How many words they're asked to say, and making sure that the educators in that setting know to give lots of opportunities and how to set up lots of opportunities to reach that goal. And similarly for school avoidance, it's like, what is our attendance expectation for right now? When we were talking about in-person school, sometimes my attendance expectation was to get to the parking lot. Sometimes it was to like butt in chair in the office. A lot of times youth and the people around the youth, the caregivers in lots of different settings, is to they tend to get stuck in this all or nothing thinking, like you're either in class the whole time or you are absent, which is really unhelpful in terms of thinking through the steps to work toward attendance. Certainly the faster we get through those steps, the better, but also we need to acknowledge the different rungs on the ladder, so to speak, that we can make use of to get some more buy-in, to feel successful, all of us in the situation. What is the small next thing that we can reinforce? Sometimes it's just, butt and share in some setting, but not the perfect one, and for what amount of time. For test anxiety, that's a hard one to break down, because I want to know more about like that's almost too broad. Is it perfectionism? Is it worry about like other people seeing their score and thinking something bad about them? Because then I'd want to do lots of practice exposure tests to say, like, I do tests with kids all the time, tests that I give them. I don't know, I printed off the internet. I don't know where I got it. But like stuff that's way too hard for them. So like I'm grading it and they're not doing well, and we're going to look at that grade and see like, who cares? Sort of
hanging up on the wall in the clinic.
Yeah.
I used to work in clinics.
Yeah, right. Back when we were in clinic, our doors were covered in failed tests. Not because we don't want our kids to care about their grades. It's not that that's even likely to ever be the case, but to loosen up the rules and shoulds and unhelpful cognitions that our kids have, to see like, I'm still a worthwhile person, even if I get questions wrong, even if this test doesn't go the way that I hope. So really, it's just about sitting down to approach the test and not focusing on the absence of anxiety itself. That's key. I think one of the things that Jen and I at least have talked about is thinking through, like maybe writing down some examples in a tool of like, what would be some 504 plan accommodations, what would be some IEP goals, and how would we word them? Because it's going to be different. I wish there was like a template we could just hand to you, make all of your lives so much easier. Unfortunately, that's not the case. Though I can definitely see this being an area for future development. So if you all, I think Kelsey mentioned this, that we're going to be asking for some feedback about what tools would be helpful. If there are specific situations or things that you would find to be helpful in your setting, please do let us know.
I have one more thought. The other thing I was thinking about is sometimes it's useful to have those plans be time limited, right? So like, if the goal is just to get the kid to school, that's great. And then the goal might be to like talk on, like give a present, if someone has social anxiety, give a presentation to the teacher, but not in front of the rest of the class. But we don't want that to be the on the plan for years, right? We want them to be able to practice outside of that eventually.
Yeah, that is such an important point, Cecily. Like the anxiety, we expect change for anxiety. Anxiety is not problematic anxiety is not a stable trait characteristic. is something we would expect to change. Otherwise, like, I don't know why we would be doing this job every day. So we need the plans to be as dynamic as we expect change improvement to be. So we need plans that are worded in a way that allow for growth.
Yeah, I always tell patients that anxiety and OCD is one of my favorite things to treat because I know the treatment is so effective. And once you get the ball rolling with exposures, it actually can be a lot of fun.
I totally agree. Exposures are my favorite because we get to be really creative and fun. But my favorite part of treatment is when kids start to get engaged and like, oh, I thought I could do this exposure today. It's so amazing to see just how brave our kids can be, even if it's hard to imagine that right now. Another question that came up a lot around 504 plans is how, like, we get it, we are so on board. How do we get other people on board? How do we get the school administrators on board? How do we get the patient families on board? What thoughts do you guys have about getting other people on board for approach versus avoidance?
Often, I think one kind of thing that comes up is that by the time we're seeing them, or certainly when they're coming into a clinic, this will be different for those of you that are in the school setting, but likely they have tried some of the things that they're suggesting, or that you can think of many examples of students who have had these accommodations that are contraindicated, like we're describing, where we're not seeing the movement we would want to see, which makes sense for those of us who are bought in, right? When we understand the model of approach, it makes sense that when we accommodate avoidance, that we're not going to get that movement that we want to see. So I think it's really, it's an idiographic approach based on the role of the person. Is it a caregiver? Is it another person's school? One of the things that we think about as kids get older, they have many different teachers. So what happens if you have 2 teachers that are on board and 3 teachers that are not? And so I think it's that approach too. And at the risk of sounding like a broken record, it varies based on the person, like we've said a couple of times here. But just really try to think about how you might be able to get some buy-in from them. And I think certainly when I hear from teachers, both professionally as well as personally, I have a lot of teachers in my life, just the difficulties and expectations, that validation goes a long way there too, right? Because we're adding another thing to their plate. It feels hard. And that's where I think talking about, providing a little bit more background about that ultimately we want to be able to reduce the expectations or the accommodations that they're needing to keep in mind, because this is going to actually help the student get back to fully participating in the way that we would want them to, so that in the short term it can feel really hard, but also in the long term that this would hopefully make things a little bit easier for them in the classroom.
I just acknowledging that this is hard. I spend a lot of my time having this conversation with different people in the school, with different parents, because everybody who goes into education, well, I would hope, but I would imagine that most people that go into education do so because they care a lot about kids. They're compassionate, well-meaning people, and it feels super counterintuitive when people like us come in and say, yeah, actually, we need the kid to feel distressed, though. That's how they learn. It feels really like, oh my God, tough love city. Like, this is the worst. Ultimately, that is the approach that has the most empirical support, and that we see people get better. And there's a way to do this in a really warm, supportive way. So it's not, punitive to the child. But it does require some ongoing conversation. And I do hope that the tools that we develop out of this seminar are helpful to you all in making the case, both to the other people in your school district that might be in charge of making some of these decisions, but also to the families of the students that you work with.
I was just thinking we need a nice handout that summarizes the avoidance cycle and then the approach cycle, right?
Yeah.
Of what, and a lot of people, once you explain to them that concept of writing the waiver, like, oh yeah, I've done that before with spiders or the dark, right? Usually people are like, oh yeah, I've done that, and it makes sense, and they're like, well, we'll give it a try.
I think that's a good point, that most people have seen this play out in their own lives in a way that they may not give like themselves or the model credit for. But it is like a real life way that we all cope with, hard emotions. Like as simple as these tiny, tiny moments, like this morning when my 2-year-old pulled a candy cane off the tree and I said, no candy in the morning before school. She was very upset. I mean, she wasn't anxious in that moment. She was pissed at me, but it was, she had this wave of upset that then, it left. And I've certainly had moments already today where I've had waves of anxiety or waves of frustration that come and then they go. And our ability to ride the wave and not be, bucked off by the wave or feel like we have to push the wave away is really key. We had a question come in from one of our live participants that asked about 504 accommodations for virtual learning for a second grader with selective mutism. And boy, this is my jam. I love selective mutism, you guys know. So there are a lot of resources out there for selective mutism. So I just want to plug some of those right now. So selectivemutism.org. There's the Selective Mutism Learning free online training course. It's like through Thinkerific or a website domain like that. Stephen Kurtz's online training. But if I was to boil down my recommendations, what I would do is to collaborate with at least the caregivers in this situation. A second grader could collaborate too, and I would invite them to have a, sort of quote voice at the table, even if it's not like a voice you can hear in a meeting with them, but they're talking with their parents about it, to set some goals of, hey, I get that this is hard, really anxiety provoking. What would be, here are like the different categories that we're seeing. So one is turning the camera on. One is talking with classmates. One might be talking with teachers. One might be just nonverbal communication over Zoom. One might be, chatting in the chat box, sharing an answer. There's so many different levels of communication. So starting to put them in order of like easiest to hardest. So we know for this child where those different levels are. And then it's really just about setting a goal. So for this week, every day, maybe a goal is to turn on the camera for, 5 minutes every hour, or, really breaking it down to something like that. And so then the teacher is just kind of tracking, is that camera going on for for the 5 minutes every hour? Or maybe the goal is to whisper one-on-one with a teacher, which means we need to make sure we have opportunities to practice that. So when would that be in the day? Would that be in a breakout room when other kids are working independently? I'm going to invite this child to join a breakout room, and we're going to talk about, Harry Potter or whatever that kid is really into, to say like, what house do you think you would be in? Slytherin, Ravenclaw. I don't want to get like some kind of copyright violation here, but just as an example, just some fun, even non-academic questions, and then like pop back, even just one at a time. And then we pop back. So they're really brief moments. And then the teacher is recording, okay, here are the opportunities that came up. Here are the times the child was successful meeting that goal, in some way of communicating that back to the parents, so that parents are aware of what's happening if they're not able to be there in the moment. Life is really different for every family. And then parents can positively reinforce that with praise and hopefully a reward system. And then that goal changes as the child becomes more successful meeting that initial goal. Then it's like, okay, well, what's our next goal? Well, what's our next goal? This is a new situation coming. We have music class this week. What would be a goal for that class? So that is, if I was to boil it down, that is the intervention for SM in school.
That was an awesome summary. But one thought I just had was that I know depending on what software you're using, there's also the feature, right, to turn off your video like being able to see yourself, which sometimes is a nice first step. Like I do right now, my video is on because I want to make sure my background looks okay. But often in meetings, I'll turn it off because it's distracting to be like, oh, is my hair out of place? And that for a kid who's anxious, that's like, it's just a nice first step, right?
That's a really, really good point, Cecily. I think we can take advantage of this virtual setting to think about like all the different ways that we can control the situation to have it be easier or harder. So maybe like, okay, I don't mind them seeing my face, but I don't want them to see my room. Like, what if they think my room is too babyish or dumb or whatever? Then it's like, okay, maybe you have special permission to use a virtual background. And you know that whole thing with virtual backgrounds where you can like fade in and fade out. That might be, maybe we keep the virtual background up and it's like the teacher's going to count how many times they see your face pop in. And then like, okay, we might take a break and fade out. Okay, now we're going to pop back in, you know, so we can be kind of playful with it in a way, you know, maybe that would be too distracting, but just thinking playfully with families about how they can meet these goals and how you can like private chat, like, nice job, I saw you turn your camera on, or you're doing it, there's that face again, I love to see you smile. Like just little positive reinforcements of like, I'm acknowledging that you're doing the thing that is hard and I know it's hard for you to do it.
I had a family too recently who like had like a stuffy visible in the camera and the kid was just like slightly off screen and then like slowly came more on the camera, right? There are ways to do it. Or maybe you're like further back away from the camera and the approach.
I love that. It's all about shaping behavior. So we don't have to expect like, okay, now we're doing the exposure, so you have to do it like the most right from the start, but we can start at some other step and like inch our way on. You know, I have some kids join like this at first, and then, you know, we get one goggle on there and then we gradually move over. So I think that's a really good point. Any other thoughts about 504 plans or IEPs before we move on?
One just general thought that came up with all of the creative ways that we can get on camera talk was I think, and this would be different depending on what the worry is, of course, but not knowing when the camera is going to be on, right? So if there's worries about perfectionism, am I going to be, you know, the way Cecily was describing, like, how do I look or how's my background look? So if there's ways where it's maybe part of it is caregivers sitting with the kid and they don't know, but periodically they're going to pop the camera on and off. And it'll be, you know, for short bursts to start or, you know, 30 seconds, but there's not that time to prepare, right? It's just, this is what happens. I was in the middle of a word or I was in the middle of a bite. And now everybody saw that I had food in my mouth, right? And getting comfortable with, especially, you know, 9+ months into this pandemic, many of us are getting much more comfortable. Our expectations of what being camera ready look very different than March, at least for myself. So helping them kind of get some of that practice and realize, you know, I'm one of maybe 18 other students. The fact that I was looking away when the camera started, nobody really noticed that. Really kind of targeting that spotlight effect concern that some of the students might have around being on camera.
Thanks, Jen. I wanted to jump into a segment of our questions that had to do with some specific samples of students. And there are a few different examples here that I think are going to be really important for us to talk about. One really pulls to Cecily, your expertise in the gender clinic. And so this question says, what's your experience with anxiety in youth who are transitioning genders or are gender nonconforming youth, I would add? How do you practice exposure while also being sensitive to the vast changes they experience internally and externally?
Yeah, I think that's a great question. And I always start with validation. So I think recognizing that that there probably are going to face some hard moments is really important. And I think helping people think through, like, what are the safe spaces for me to practice? Like if I want to dress a certain way, can I do that at home or with certain friends? I'm thinking through, like, is your school actually going to be a safe environment to come out? I think when we're talking about doing exposures, right, we talk about wanting to do it for situations where we don't really anticipate that there's a real danger. And for some people, there is a danger in the coming out process. So just helping them think through that. I certainly do that with people when I meet with them in the gender clinic, and think through like who might be like a good ally if I am having some struggles, like who might be able to turn to in my school environment or at home or else outside of that environment to help me get through those tough moments. But I really do think thinking through the real life safety concerns is extremely important when you're going to help people start to kind of live more authentically and just figure out like where can I test things out. I've certainly had teenagers who are like, well, I'm going to wait to do it in this space because I don't think people are going to be very accepting. And I think that's okay, right? Everyone has their own process. And I think one more point, that sometimes people's anxiety is not all about gender dysphoria. And so sometimes teasing that apart, like I certainly have some patients who are like, well, I just don't like giving presentations and I've never liked giving presentations. And so that's not necessarily about the dysphoria. And so in that case, I would be all about encouraging them to do exposures. However, for some patients, they don't like giving presentations because they don't like the way their voice sounds. And that's a totally different expectation to set. And so then I'd probably lean more on the validation side while also figuring out, is there a way to start doing some exposure in this area where they would still feel kind of confident to do so, if that makes sense.
I think that makes a lot of sense. And I think it just points out, like you're saying, the need to really validate and acknowledge that there are objective threats to many people in our communities, whether they are gender nonconforming youth or people of color. One of the other questions that came up here is, how does anxiety intersect with racial microaggressions, gaslighting for people of color? Thinking about how the alarm is picking up on real threat to well-being, but others are invalidating the idea that the threat is real or present. So just wanted to kind of bring these two together in recognizing that there are real objective threats and safety concerns for many people in our communities. And how does that dovetail with everything we've been talking about with exposure here? So Cecily, I think you started it by saying, like, where are the safe places? Let's be careful in our assessment about where there are objective, real threats and acknowledging that. And where are there, are there places, like in your example with the social, presentation, speaking thing, are there examples where there isn't an objective threat and a good place to go, at least start to go after for exposures there? What else would you all say for this question?
Again, we're going to sound like a broken record here, but I think validation, especially, and in the question itself, really acknowledge this at the get-go. This comes up if somebody feels like they're being questioned about their own experience, and that's infuriating for anybody, I think. And so I think really kind of highlighting for them too, because I think part of it, part of what we want the students to learn is when should it be an exposure? What skill should I use here? And part of that learning process, that's the skill, right? Is when is this exposure? When is this I need to I shouldn't have to handle this, or something else is getting in the way. This is an objective threat and I need to be thinking about safety. So calling that out and helping them learn, I think, is a big process there.
Anything you want to add, Cecily, or we can move on to the next question?
I was just trying to think if there's anything I wanted to add. I mean, I think in terms of like microaggressions and anxiety, that of course those things are linked, right? That people who have experience chronic racism are more likely to experience more stressors. And I was actually just reviewing an article on this, and that people are more likely to have more like mood and anxiety and other like physical health concerns as well, just from having that chronic stress. And so like, I don't think that exposure necessarily has its place in when you're talking about racism and microaggressions, right? And that validation and really helping people, not that you necessarily know exactly where they're coming from, but just listening to people and helping them to hear that you hear what they're saying and not saying, oh, did that really happen that way? Like that's not a very helpful question. Or, oh, that shouldn't have happened to you, but yes, it did happen to me. So acknowledging that, things, that life is hard, and people can be racist or sexist or transphobic, right? That it's really important just to recognize that those are real things that happen to people. And oftentimes I'll talk to parents, not necessarily about like race or gender, but just in general of like that sometimes the best thing you can do is just listen and validate. And you don't need to solve the problem either, right? It might be impossible in some situations to solve the problem. Yeah, for a lot of teens in particular, they just want to be heard.
I think that's a good point, Cecily. There was in the last seminar, we shared a flow chart of like when does exposure make sense? And one of the pieces right at the top is there an objective threat? And racism is an objective threat. This is not something, there are real safety concerns, and there are, and this is not something that I feel like that we need to expose kids to in order for them to learn how to cope with it. That's not a place for exposure. It's absolutely a place for exactly what Cecily was saying, which is validation and listening. So just want to say that up front. And I think we've all been broken records on this, but it's okay. Validating for kids that things are hard and never ever promising that the bad things don't happen or that shouldn't be your experience. It's not that bad. Come on, kid. Like, even whether we're talking about something that has an objective threat to it, like racism, or we're talking about something like giving a presentation in class, turning your camera on, whatever. We undermining, kind of gaslighting the experience of difficulty is going to be counterproductive across the board. So the importance of validation here is cannot be understated, I don't think. So we never want to tell kids that's not how it is. It's not so bad. But we want to help them when there are no objective threats. We want to help them learn that their maybe a false alarm is going off through experience versus us saying, come on, kid, get over it. It's not that bad. That's not really how it happened. It's not, that will drive them farther away from you and have them feel less heard, more anxious, more distress for sure. Okay. Next population that came up a couple of times has to do with kids with autism. So like, does this treatment look different for kids with autism? I'd say no. We do exposures still with kids with autism at varying levels of functioning. At lower levels of functioning, you might imagine it's much more parent or caregiver driven, much more visual. But youth with autism, it's so common for them to have comorbid anxiety or co-occurring anxiety, and exposure is still the key element of treatment there. Anything else you would say about autism?
I think the only thing that I would add is that previously when we've talked about exposure, we've talked about the kind of what we call post-exposure processing, or in the moment of more cognitive strategies that are directly related to the exposures to help with the learning. And depending on the level of functioning for that person, you would rely more on the behavioral strategies so that that learning will still happen, and it just needs to happen in a different way based on their different learning ability. So that's kind of the way that you would think about adapting it. But the behavioral principles there are still the same.
And I think this at least starts to address one of the questions that we have in the Q&A about, middle schooler with anxiety and rigid thinking and autism and ADHD and lots of oversharing and, self-comfort measures, and they're not in public. So they're, they don't have maybe the possibly otherwise present social pressure to kind of hold some of this stuff back. And I really think here, goes to exactly what Jen was saying, is like setting some behavioral goals and and some cues with that patient in a way, which will look different depending on however your virtual classroom is set up. How we can say how we're meeting the goal to reduce the more problematic behaviors and increase the more productive adaptive behaviors. How can we reinforce that in a way that is meaningful for this child would be key. What would you all say?
Yeah, I would agree that trying to find a specific, are you hoping that they'll only share for 1 minute of every hour or whatever it is. It's hard. It's the opposite of what we're often dealing with online school, of wanting kids to vocalize. But just figuring out, is there a way to flip it to the positive, what you're hoping to see, and rewarding that.
One of the other questions we got in the question section here is, how do we help parents who are intellectually challenged or who are struggling with mental health issues like anxiety? It is, I just want to say, incredibly common for parents to be experiencing anxiety when their kids come into clinic with problematic anxiety. Anxiety is highly genetic. It's also, perpetuated through social learning. So very common for them to run in families because of either the biological link or just the environmental link. I'm going to pass this question over to one of my fellow panelists as my dog loses her mind in the background. So.
I was just going to say, one of the suggestions that came up from somebody earlier, just thinking about creatively how we're sharing the information, right? I think I've said this in one of these sessions before, but as psychologists, we love to make things complicated. And sometimes one of my favorite things to be able to just talk to people from different fields to figure out how we can, because what we're talking about ultimately is not that complicated. It's just we overcomplicate things, we overthink about things. So I think getting creative with how you're sharing the information. Don't, figure out how much information to share at one point. Check in. Repetition, I think, is important for all of our learning. So we're going to learn as we think about it more, as we've had time to kind of take away and come back and discuss it, reevaluate. Also getting creative with the way that we share that information. So verbally, written, using visual aids as the person suggested, which is the point that I was starting with and got a little lost there, sorry. But just really kind of thinking about how, what's the best way, just as we think about for our students who have different learning needs, what are the best ways of sharing it for that family?
And I was thinking with the anxiety question in particular, that if you've helped the student get connected with a therapist, encouraging the parent to try to be involved as much as possible, especially for younger kids. I think it's really, really important for parents to be involved. And what I've found is that as I work together with a kid and their parent, that if the parent also is anxious, a light bulb moment starts to happen. They're like, oh, I could apply that skill to me too. I think they start doing that and actually start seeing changes, is what I've noticed, at least.
I totally agree. And apologies for having to go off camera there as I dealt with the real life. It happens at my house too. I think the other half of the question was about a parent who had intellectual disability. Did we cover that part yet? Did I miss that?
Jen talked about it a little bit.
Oh, great. Excellent. Thanks, Jen. Sorry I missed that. We have another question in the chat from Leah, who says, what about, encouraging youth to take a minute to reflect on their thought, feeling, and behavior cycle that was just triggered by anxiety? Like, is there a more helpful thought? Is there a thinking error here? And worried that this is falling into a journaling sort of situation. I think this is fine. I think it's helpful for kids to take a minute to reflect on their experience. I would just want it to make sure that it's paired with the appropriate exposure for the situation. Again, journaling isn't bad. I think a lot of people, maybe even on this seminar, would really love to journal themselves, and go for it. It's just not the primary intervention is all. Anything else?
I would agree. I mean, I think what you described is, social emotional learning, which I'm a big proponent of. That's like what I studied in graduate school. And so I think it's really important for people to be able to identify their thoughts, feelings, and behaviors. And often that identification of how you were feeling in that moment, or that thought, can already start to regulate your emotions. So I think it's very important for students to have that practice. So I don't think you're doing anything wrong.
Okay. And seeing another question here saying, how do we support parents whose style is to protect their kids from pain and discomfort, reinforcing anxiety by letting them stay home, aligning on their complaints about school? And oh boy, is this a tough task. You guys have heard me talk a lot. I'm going to pass it over to my co-panelists. Take it away, you guys.
I always start my parent-only seminar talking about this exact issue and saying, as parents or as caregivers, we're biologically driven to take care of our kids. So it makes perfect sense that you don't want to see them in discomfort or pain. I know with my 3-year-old, if she starts to cry or get upset, I don't want that to happen. I also look out for danger for her, probably more than she does for herself. So it's totally natural to do this. And at the same time, it might not be helpful in the long term to continue on in those patterns. So think about, are there ways that I could change my behavior to let them experience a little bit of anxiety and realize, one, that the kid can realize that it's not as bad as they think, or that they can write out that way, but also for parents to realize that, they can do that hard thing and the world didn't end either. I think that's can be a huge aha moment for parents as they start to let go a little bit too.
Yeah, one strategy that I've tried to kind of get parents to that point that Cecily was just describing is kind of taking a step back and thinking about a values perspective and what their view is of their role as parents, what their goals are for their child, and then try to highlight some discrepancy between what they're currently doing and how that might get in the way of the goals that they have for their child. I think this comes up, that this idea comes up a lot when there's high expectations, high functioning families sometimes, and realizing that if you want your child to be able to successfully take these steps independently, then you need them to take the earlier steps before they're able to do that, right? So kind of starting there and thinking more broadly about, again, kind of thinking, I was just talking with somebody today and I just loved this metaphor, but if you think about artwork, specifically pointillism, if we're getting so fixated on the one dot, then we lose the whole rest of the picture of seeing the people sitting on the side of the lake, seeing the different animals in the scene, right? So taking a step back and allowing them to connect their specific parenting behaviors and moments to their broader kind of views on parenting and their goals for their child.
Thank you both. I think we're going to stop there, and I'm going to pass it back to Kelsey. For sure, we didn't answer every single question. We would love, if we could have 5 more hours to do that, and you guys really wanted to sit with us, we could do that. But we will use this information to help build some tools that will hopefully be helpful. So otherwise, take it away, Kelsey.
Awesome. Just want to thank the 3 of you very much for answering those questions that were submitted ahead of time, and taking some of our live questions. I've just learned a lot myself as a parent, and appreciate the time that you spent with us today. So as we wrapped up, I think Kendra teed this up perfectly. Our next step is to work on a toolkit, and we're going to reach out to anybody who registered for any of the sessions and just ask some quick, brief questions, because we know everybody's just over surveyed at this point. If you've got some things that are sort of fresh in your mind about what you think would be helpful, I'm going to ask that Natalie put our email in the chat right now, and feel free to just email us if you think by the time we get a survey out, you're going to forget what you thought was helpful. And then what we'll do is, once we get all of that put together, we will wrap this series up late in the spring with a final webinar that will walk you through the toolkit, and probably another opportunity to go through to review some of the things that we've talked about throughout the series. And want to say thank you to all of you to participating today and throughout the series, and for the work that you do with families and kids, and hope that you'll continue to reach out to us as you need additional support in the very important work that you all are doing.